Hello, my name is Scott Dobbins. I'm a retired firefighter from the city of Marietta, Georgia. I was president of IAFF Local 1460 for about 14 years, and I was on the city of Marietta pension board for 7 years. I'm making this video for the retirees that work for the city. Recently, a letter was sent out by the HR department talking about health care was going to be going up to $337.50 a month for the retirees' cost. Well, this kind of set off a little firestorm, and a lot of guys know I have a lot of documentation. I made a couple videos about how the city's treating the employees, and so my phone started ringing off the hook. So initially it looked like what they were saying was, well, the employees were going to be paying $337.50 a month to the city for this Aetna Advantage plan. And within a couple of days, another guy that worked at the fire department used to also be on the pension board, and Billy B, we'll just say who that is. He got a document that he put on Facebook, and what happened, it was actually the city saying, well, you're going to pay, but it's based on these parameters, and the parameters are for how you get your benefits are based on date of hire. And that's it in the nutshell. It's just basically based on date of hire. So, but I have a lot of documents, and I had a lot of people ask me, say, hey, you want to do something? So how about if I just make a video, and what I'll try to do is, or my plan is I'll talk about a document, and I'll insert that document into each one of these, into this video as I go along. All right, so to understand how we got where we're at, the city of Marietta in 1980 took a vote to withdraw from Social Security and Medicare under what is called a 218 agreement. The 218 agreement is an agreement between whatever municipality and the federal government saying, hey, we're going to pick up the cost of, and they could opt out of Social Security, Medicare, both. And they opted out of both, Medicare and Social Security. And they told the federal government, because there was guidelines, we'll take care of them, because that's the agreement. So that's the 218 agreement. As was the document that they signed. Well, apparently when they took the vote, from what I was told, I wasn't working there yet, from what I was told, that there was so many people that voted to get out of Social Security and Medicare that the city thought they didn't understand what they were voting on. So they sent out a lot more paperwork and actually had a second vote. So I've got a letter, and I've got 3 documents from 1980 that's kind of comical. These documents are now 45 years old. They look like they came out of a tomb in Egypt. They're sold at this point. So, but I've got a document dated 9/18/1980 that talks about withdrawal from Social Security. And what it's doing is talking about the advantages and disadvantages of getting out of Social Security. And one of the things it states in there is obviously the younger you are, the less Medicare or Social Security you're going to have down the road. And the reason they're saying that is if you're not paying into it, guys and gals, you're not going to get anything. All right, then I've got a letter dated 10/27/1980, and it's to the department heads. And basically it's giving the department heads a brief overview of how to describe what's happening with the withdrawal from Social Security and Medicare. You know, it's the talking points so they can explain to employees. And on the same date, 10/27/1980, I've got a document that talks about them getting out of Social Security and Medicare, but it's sent to the employees. All right, so we get asked all the time. I'm part of a group, and again, all these benefits apply based on date of hire. I'm part of a group that was told the city would pick up 100% of our health care, and we were told our spouses were locked in. All right, so trying to find out where this came from, years ago, the union, I had Ed Bailey, who was deceased, Ed, and filed an open records request for a time frame of documents from the pension board. And I actually have the open records request and the documents. So we received a document from the minutes of the meetings from the pension board on May 11th, 1981, And in that meeting, Robert Hutchinson, who used to work for the police department, everybody called him Hutch, he made a motion that the city pick up 100% of the employee cost for health care, but only upon retirement. So basically, when you retired, they wanted you to pick up 100%. It was seconded by the city manager, Jack Crane. The vote was unanimous. Well, just because the pension board passing it, the city also has to pass it because they're controlling more of the funds too. So it goes to the pension board, and in that same group of open records requests, we got a document back dated 7/6/1981. And the document 7/6/1981 says that the council has agreed to pick up the cost of health care as recommended by the pension board. So that's where we get our 100% from. Now, locked in retirement for our spouse, where does that come from? Well, it's in the pension plans. Because you got to understand, when this was done, the pension board controlled both health and the pension, which is what needs to go back to. We don't need a closed group doing things with our health care that nobody has a clue what's going on behind those closed doors. So at the time, it was controlled by both. Well, in both pension plans, the 402(2) and what they call the consolidated plan, there's a statement in there, and I'll post this too, that states the city has the ability to amend the plan from time to time, but no such amendment shall reduce the accrued benefit of any employee or any beneficiary. That's where the locked in, or the city likes to use the term frozen, comes from. That's where it comes from. Nope. Once you come to work for the city, what the benefits you're offered, that's the way it is. They're frozen by that ordinance. Every benefit you come in there to. So that kind of give you just a brief view here. When you go to work for somebody and they offer you a job and they offer you a benefits package, that's an implied contract. All right, because they're dangling a carrot in front of you that says, hey, come work for us, and this is what we're going to offer you. Well, 20 years down the road, they can't go, nah, we're going to take that out, because you could have went to somebody else at that same time and had those other benefits. So it's an implied contract. All right, so we talk about the your locked in rate. There is a brief update in the pension plan where they define frozen in time. And when they say frozen in time, it's that you can't change the accrued benefit. And what they talk about is they didn't have a way to really discuss, or the code didn't say anything about what happens if the cost of the benefit went down. So in other words, let's say you retired, and in our case, my health care is free, 100% paid for once I retired. My spouse is locked in. Well, when they locked in, it was $500 a month. All right, it's locked in at $500, and 2 years later, they were able to get a contract for health care for $450. Well, could they go down? So they worded it so that people understood, yes, they could go down to $450, but should the plan go back up, they could go back up, but they couldn't exceed the locked-in rate. So let's say they were $500 one year. The next year dropped to $450, so your payment dropped to $450. Stayed $450 for a year. The next year it's $525. Well, it goes up to $500. You don't pick up the $525. You're locked in at $500. A good document for everybody to look at if you're extremely bored, but does a great job of defining where all this stuff comes from, is IRS Publication 963. And basically it's the 218 agreement documents, what I'd like to call it. And it discusses how you end up with the parameters with your pension plan, that you have final average earnings on your pension over so many years that you get like a 1.5 multiplier. And that's where all those documents come from, because the federal government, when you signed that 218 agreement, said, we don't want you coming back in 30 years and complaining that you don't want to pay for these people anymore. You're agreeing to take on the burden. That's as simple as it gets. All right, where do the little problems kind of pop up? Okay, so they opted out in 1980. April 1st of 1986, kind of a close window there, The federal government came out and said everybody goes under Medicare. And I don't know, I guess Medicare was starting to look like it might be defunded by not having people pay into Medicare. And I'm going to ramble here for a second. You got to realize they pay for people to be in Medicare. People be in Medicare for 35 years and they get killed in a car wreck. So all that money that went in there never gets paid out. So it benefits the plan to have people paying in because you have mortality that just doesn't ever pay back out, or people draw Medicare for 1 year and they die. So it's beneficial to have paying in. So they came in and the federal government amended it and said, no, everybody goes under Medicare. Not necessarily Social Security, but had to pick up Medicare. When the city had an opportunity at that date and time, if they wanted to, they could have joined Medicare and Social Security for all the employees. All they had to do was have a 218 agreement that said, hey, if you guys want to have an additional pension, we'll go back in and you guys can pay into this and you'll get a little extra nicer pension as you go down the road. But we didn't. And there's a thing to get into weeds again a little bit. Government pension offset and windfall elimination provision, those were in play. And they ended up just being taken off the table here quite recently. But at the time they were in play. So there was not advantages for getting in, there was disadvantages for getting in, and that stayed that way till really 2025. All right, so effective April 1st, 1986, everybody the city hires now starts paying Medicare. Because the way the government works, everybody hired prior to April 1st of 1986, they were, if you use that document I was talking about, IRS Publication 963, they were Medicare exempt. Because there's a flow chart that's in this thing. I'll see if I can find this paperwork. My paper's trying to stick together here. Give me just a second. One more document. And that's glued together here, folks. Okay. That's from that IRS Publication 963, and it's a flow chart that shows whether you're Medicare eligible or Medicare exempt. Well, because we continued employment with the city without a break, we're Medicare exempt. Everybody hired after April, they're Medicare eligible. So here's where the rub starts coming in. Based on data hired, you were offered different benefits. Basically, everybody's benefits were the same until August 14th, 1991, as far as what the benefit was offered. But if you were hired after 86, up to that date, you were paying Social Security. You were paying Medicare. Now, I don't have a problem with the people that paid Medicare having to pay pick up Medicare when they turn 65. The issue is for our group, hired prior to April 1st, 1986, we are Medicare exempt. And the city came back under Bruton and said, hey, these people here need to go under Medicare. Everybody, their thought process, well, the city's policy is what we were told. The city's policy is that everybody's under Medicare when they turn 65. You can write pigs fly on that document, don't mean they're going to, because here's the issue. We are Medicare exempt. If I went out and earned enough part-time job money to qualify for Social Security and Medicare, that's my business. That's not any of your business. And the city came back in and basically bullied some people into paying into Medicare. Now, I know for a fact, I'll give you two examples. These guys are already in their 70s. Frank Reddick, he signed up, and because he took A and B, and the weird part about Medicare is if you don't take Medicare at 65, you take it at 67, you get a penalty. And you have to pay that penalty every month. Well, Frank and them were in their 70s when they took it. So they had a substantial reduction in their pension because the city came out and said, no, Medicare is your primary. Well, the city actually lied to them. No, it was not. They were Medicare exempt employees. The city had opted out. Another employee named John Garrett, both these guys are deceased. John Garrett told him, said, well, you know what? I did earn enough to get Social Security and Medicare, so I'll take A under Medicare because it's free and it benefits me, but I'm not taking B. You'll have to pay it. And I know the city never forced his hand, and so they paid his B portion, or they kept supplementing his pension or his health care so that he was covered. So that's called setting precedent, city. And when it comes to precedent, I've got an 11th District Court ruling from 1987. 1987 is the District Court of North Georgia. Where the city lost a lawsuit, and it specifically states in there that they, through code and passages of rules and regs, that they reduce the accrued benefits, which they can't do. That's what we're talking about. So this Medicare issue, now the city, because they came out and said, hey, you've got to start paying, and even though they're saying they're not, they have awoken a sleeping dragon. Now people are going, should I be paying at all? No. If you're Medicare exempt, you should not be paying at all. I told them that I was not going to ever take B. I said, I might take A, but you're responsible for paying my health care. That was the implied contract when I came to work for you. And to give you an idea, in 2013, they finally really had people hitting 65 at the city that had never paid into Medicare. And all of a sudden the city's going, well, Medicare is your primary. And they're going, I don't qualify for Medicare. So the city's going, wait a minute, we're going to have to pay for these people. Yes, you are. That's what you said you would do when you signed that 218 agreement in 1980. And so the city said, well, you know what? Let's see if we can get out of this. So there was, in March of 2013, there was 51 employees left that were Medicare exempt. And the city came back to them and said, hey, and what they actually did was they met with us. And when I met with them, I said, so what's this about? And I brought up the fact that, yeah, you got people hitting 65 and you're having to pay all their health care. And they went, yeah, exactly. And I said, you're wanting to dump them on Medicare. I said, yeah, you never paid into Medicare. I said, that's an agreement with you and the employees. You have to do it. And they keep getting that same runaround speech. Well, the city's policy, I don't care what your policy is in violation of your ordinance. So, anyhow, they come out with what's called a modified 218 agreement. And they wanted the employees to vote to join Medicare. It was the only 51 I was active. Couldn't do nothing to people that was retired. So when they had this vote before they did, because when I met with them, I said, okay, so how's this going to work? I've got enough hours because I work 2 jobs to qualify for Medicare and Social Security, but I've got no plan of taking Medicare. You're going to be my health care, and I'll get whatever I get out of my Social Security is my pension. Because if I start paying over here, I'm reducing my accrued benefit for a product you're supposed to be providing. And they said, well, here's the deal. If you don't qualify for Medicare, we're going to buy back the necessary hours so you qualify for Medicare. If people are like you, we're not going to do anything. You're not going to get any funding, no money, no stipend, no nothing. We're just going to tap your money when you retire. Nope, you can't. Again, it violates city ordinance, state, and federal. It violates all of them. There's a thing called the Takings Clause in the United States Constitution. Just because some city writes it on a piece of paper doesn't make it legal. It's that simple. But they go ahead with their vote because they know people will vote to join in. So you've got people that signed, okay, to take the vote, they had to set up this 218 agreement. For every state, there is a 218 agreement coordinator. And I contacted this person and said, hey, can you tell me how this vote's going to be done? And it was a lady, and she goes, well, the city did something here we've never seen before. They had this worded in a fashion that if you don't vote, it's a yes vote. So if you decide not to vote, it counts as a yes vote. Okay, that to me just showed their true colors. So that frustrated me. I contacted him with Shannon Barrett. I called Sharon up and said, hey, you need to let the people that are in this vote, they know that if they don't show up, it counts as a yes vote. I said, because that was chicken crap. And I'll give her credit, she did. So I voted against it. I wasn't going to vote for an increase and to reduce my benefits that they promised me. That was stupid. So I didn't. Some people did. Now, a question I need to ask them is, if you only got Medicare and you don't qualify for Social Security, are you having to pay for your Medicare part out of your city pension? So in other words, going out the door, let's say you got $2,000. Didn't cost you anything for your health care, you got $2,000. Well, they signed you up for Medicare, and because you have to take that Medicare benefit that they bought back, now you're getting $1,800 because you have to pay $200 out every month because you don't qualify for Social Security. And that's where I'm at. I'm not taking part of the Social Security I earned working a second job to offset a cost the city was going to pay, that is by contract they have to do. And I have a feeling that, guys, it's as simple as this. It's going to take a lawsuit to get us there. City doesn't care. And why is it tough to fight City Hall? Because they're actually suing you with your money. So that's where this needs to head. I'll let you know. I've already sent all these documents to an attorney in Atlanta. She's previewing them. And initially it was about telling the employees they were going to have to pay. And now it's just changing over into the fact that, the Medicare exempt group shouldn't be paying. All right. I'm going to say this because it needs to be said. When the city, and if I said it in the beginning, I'm sorry, kind of been rambling there a little bit. When the city sent that letter out saying, they worked as a team, this is the best cost they can get, this, that, and the other, that's not true. You as a organization can offset the cost as much as you want on these benefits. You can pay for them 100%. But you've got a council that's reduced in the last several years, my understanding, the taxes 5 times. If they're cutting the taxes on the citizens and going up on the cost of the employees are paying for the increases to services, not the people that receive them. That's a problem. So the meeting date, and everybody needs to go there, is October 15th, 2025 at 12 o'clock for the retirees. If you're a pre-retiree, it starts at 10. I'd suggest everybody comes for both meetings. And what we need to do is inform them they're in violation of the ordinance. And by what they're doing, it gets kind of weird. There's a new statement that's been added to the pension plan. By them sending that out, it's actually a fraudulent statement telling people to do that, so they'll have to pay the money back according to the way that statute reads from the state at 3 times the loss, and anybody that's been paying in it needs to go back 7 years. So it would be 3 times the loss times 7 years. And that's something I think we need to do. I'm currently not eligible. I'm not that old yet, but I'm not going to be signing up for it when the time comes, so I'll be in the middle of the mix too. So I'm going to try to get this video wrapped up today. I'm going to try to insert all the documents that I can along the line with each of my discussions. And I've got PDF files of these things that down the road we can get it set up and try to figure out a way to email those out to anybody that wants them. So again, thanks for your time. Goodbye.